Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman and e hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapus. On this episode, we are joined by guest Vaughn Bowles, and he is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribe of Wisconsin, and he is here to answer some of our COVID-19 questions. Welcome, Vaughn.
Thanks.
Good to have you, as always.
Thank you. It's been like since last week. It's been forever.
Okay, so our first question was, can a person catch COVID-19 twice? And I think maybe we talked about this before, but it seems like people are asking this question a lot, so I figure we would talk about it again.
It's still a pretty valid question because the answer is a big maybe right now, and a lot of the scientists are really working on it because it is a really important question right now. And they have some early studies out that show people that have had it have been reinfected, but the population size for those studies are extremely small, and so it doesn't provide enough statistical evidence for it to be really predictive. And it's speculated that the people that have had COVID and then have been reinfected actually have one of the other strains that have been floating around, since there are two major ones right now. And anytime anyone's infected, the virus can mutate in them again, creating a new strain that, might be passed on to someone else. So they're not sure at this point. They're also doing a lot of antibody testing right now, and some of the tests show that antibodies disappear, rather quickly. But again, the sample size isn't really large, and so it's not very conclusive. And so right now we have a big maybe. Best piece of advice at this moment is, take care of yourself. And if you do know a friend or loved one has COVID, don't go and hug them or hang out with them and spend a lot of time with them, especially if you haven't had it yet. So, practice precautions. If you have had it, you may or may not be safe. We're not sure yet. Sorry.
I have seen some people talking about having COVID parties. I mean, not people I know personally, but just people out on social media having these COVID parties.
Not a great idea.
I'm like, we don't know if you can get it again. So
because if you do, you just got yourself sick for absolutely no reason and put yourself through something that's disgusting and miserable.
Right.
So, yeah.
Okay. So what is occurring, and I think this is referring to specifically here on the reservation, what is occurring when people are testing positive for COVID, and where are they going?
So it kind of depends on the severity. If someone is tested, they're obviously going to ask to be isolated from their family and friends until, the test results come back. Usually that's fairly quickly. If you're having symptoms and you've been tested and they're mild or medium symptoms, you'll just be sent home to isolate yourself and do symptom support like we've talked about before, drinking lots of fluids, trying to get a lot of rest, staying away from family and friends, and going out into the public as little as possible. If you're high risk, you'll actually be probably sent to one of the hospitals. I know Theta Care in Shawano has several beds that are available for COVID patients, and there are a few others, in Green Bay and Appleton area. You'll usually stay there. Average stay at this point in the hospital is about 4 days, and then they send you home, and you'll be contacted by a healthcare provider every day to make sure your symptoms aren't getting worse and that you're recovering properly. They'll also want to retest you, several days down the road. You'll want to check with your healthcare provider about that, but usually they'll have you tested, after your release, maybe a week down the road and stuff, to make sure you're clear. And one thing they'll try to make sure of, if tests are available, is they'll test you a couple times within 24 hours to make sure the virus is all cleared out of your system. So,
okay. I had seen somewhere, I can't remember where, but somebody had said that Manasa Key is being used for like isolation or something like that.
Yeah,
Is there any
right now
truth to
the
that?
tribe is using Manasa Key facilities as an isolation location. If you can't isolate at home, or for whatever reason you don't feel safe, they've used that location for individuals that don't have anywhere else they can safely isolate themselves from their family. So yeah, that is true. It's not just a rumor. I think we've had 3 or 4 patients stay there at this point, and they've all successfully recovered there. And it's worked out pretty well for the most part.
Okay. So how is COVID affecting services that we are trying to provide when there are COVID positive people in those buildings?
So if there is someone that's COVID positive, what we try to do at that point is have that person immediately go home and immediately isolate. The building, depending on which building it is usually shut down, and then a thorough deep clean is done with these wonderful fogger machines that essentially spray disinfectant everywhere. It's a giant mist to make sure that every nook and cranny of the building is cleaned out. And so that's why at this point we have, all of our services are back up in operation. We only have, half of our staff in each of those buildings, and you have to make an appointment to go in. But we feel at this point we have a protocol in place that keeps the building clean, safe, and, if anyone is found having it, we know how to take care of it and stuff, so the rest of the staff can resume their work, usually, within a day or two, without any risk to them. And then, places like the rec center and stuff aren't open yet just because there's so much traffic in and out. And so that'll be reopened in the 3rd phase of things.
Okay. Is someone who has had COVID and recovered still able to infect other people?
So that's something the CDC is still looking into a little bit. They do have recommendations out, though. If you've had it and you're fever-free for 3 days, and you have improved respiratory symptoms, less coughing, easier to breathe, things like that, they usually say you can see people if it's been 10 days since your symptoms first appeared. But that really depends on, what your healthcare provider advises. If your symptoms aren't improving, obviously you're still contagious and you don't want to be around anyone, and you'll want to talk to your doctor about that. If you've received 2 negative tests at least 24 hours apart, that's usually a good indicator that you're no longer contagious. If you've been tested for COVID-19 but don't have any symptoms, though, you'll want to wait another 10 days and stuff from that time of the test that confirmed it before you go out and spend time in the public or interact with people again. And for people with weaker immune systems or immunocompromised states, that period is going to be increased because obviously you could infect yourself, be infected by others, and so you'll want to stay quarantined away from people for an extended period of time. So it's really something that you want to take precautions with, since they're still doing a lot of the studies on that as well.
Okay. Through social media, it seems like COVID is affecting more people without underlying health conditions. Is there truth to this?
So, sort of. I mean, there are cases, and you'll read about it in the news or on social media, where, a perfectly healthy individual comes down with COVID-19 and it hospitalizes them. Yes, that does happen. The odds of that happening are significantly lower than someone else who might be more at risk. I mean, a large-scale study done in New York City found that, of people who were diagnosed with COVID-19, you're most likely to have 4 conditions taking place. One is you're over the age of 63 or older. You really can't do anything about your age at this point. So if you have that condition, you're at a slightly higher risk.
We haven't invented aging backwards yet.
I know. I'm working on that. I'm working on that in my garage right now, and I'll get back to you when I nail that one. There are a couple other things that are comorbidities associated with COVID, like severe COVID-19 cases, that we can control, though. One is hypertension or high blood pressure. They found that, at least 57% of the cases that have severe COVID cases are also have hypertension or high blood pressure. Obesity is one. At least 41% of severe COVID cases are obese. And then diabetes is the other one. And about 34% of the patients with severe COVID cases also have diabetes. And it's kind of something that is kind of a snowball effect. Usually when individuals are obese, they also have hypertension, and very frequently it leads to diabetes. So if you have one of these comorbidities, it might be leading you towards the others as well. So if you have one, it's not great. If you have multiple of these comorbidities, it increases your likelihood of a severe case and stuff. So, there are things we can do: diet, exercise, to work on some of those variables. But in most cases, healthy individuals usually don't get severe cases. Even if they do catch it, it's not nearly as problematic or as dangerous for them, and they'll usually recover.
So it's not impossible, but it's much less likely.
Yeah, it's much less probable. I had a friend of mine who, great health. He was a little bit older though. He was in his mid 50s or so. But he was a marathon runner. I mean, he was in great shape. Came down with COVID-19 that he acquired while he was traveling, and it put him in the hospital for several weeks. So even without comorbidities or other health-related issues, you can get bad cases of it. And so that's part of the reason that, social distancing and, wearing masks and hand sanitation has been stressed, because, people don't have innate immunity to it right now, and it can be bad for them. If your health isn't great right now, though, you'll want to take extra precaution.
Are there building ventilation protocols in place for tribal buildings?
So some of the tribal buildings, like the clinic and the casino, do have regulations regarding what kind of ventilations they have to have in place. At this point, though, the tribal members and the IC team feel fairly comfortable with what they've been able to do with the maintenance departments. And we have the HVAC, or the air systems, running about as high as we can and circulating the air through the buildings as quickly as possible. The reason for this is what they call turbulent air, or air that's in motion, decreases the likelihood that COVID will remain suspended in the air. And so moving that air not only purifies it, but also kind of causes COVID to settle. And so right now we're doing as much as we can to ensure there's airflow through the buildings so they remain safe for tribal members. So no protocol for some of the buildings, but definitely for some.
Okay. Is it safe for people to share masks?
So sharing masks, it depends on your type of mask. If you have something like an N95 or a surgical mask that's disposable, those are something you don't want to share with another individual. If you have a cloth mask or a reusable mask, yes, you could share it with someone, but you definitely want to sanitize and or wash it first. If it's a cloth mask, you can send it through your laundry on the warmest setting with soap and water. If you wanted to use a bleach solution, though, you could mix up a bleach solution with like 2 teaspoons of bleach to 1 quart of water, or if you have a whole lot of laundry you want to do, you could do 5 tablespoons of bleach to a gallon of water, and then just soak them for like 5 minutes at a time. And that usually does a pretty good job of clearing off any sort of bacterial or virus that might be associated or hanging on it. And then you could either dry them on the highest heat setting in your dryer, or just line dry them and hang them in the sun. You want to make sure the sun's out, though, because that's provides UV lights to sanitize and deactivate any viruses that may be on the masks. So you can share masks. Just be certain that the type of mask you're wearing isn't like a one-time use thing if you're going to give it to someone else.
Okay. Was there any final message you wanted to give people?
Really appreciate the feedback that we got from everyone this last week. We sent out some surveys regarding COVID, and we really appreciate the feedback. We had a lot of people respond to it, And we're going to try to answer as many of the questions that we receive from those surveys. And we're also going to try to tailor our message accordingly. So it'll be able to reach, more tribal members, and it'll be more helpful for each of you. So thank you. Thank you for that.
Thanks for coming on, Vaughn.
You bet. Thanks for having me.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. We are aiming to do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19, so please send those to us via email at podcast@mitw.org.